760 101.1 FM, Indiana in the Morning, presented by First Commonwealth Bank. And we're going Facebook Live this morning with Lisa Spencer, Indiana County Department of Human Services, the Children's Advisory Commission's Kathy Abbey Baker. Ladies, good morning.
Good morning.
We have an interesting segment set here. You did that in perfect harmony, by the way.
We practiced.
The segment today is a two-parter, and we don't normally schedule two-parters, but this is a big topic. Big survey conducted last year and early this year. Indiana County Speaks Up, measuring the human services needs of Indiana County's residents as identified by them, which is a unique way to approach it, Lisa. And maybe not unique, but it's good that we have this approach right here.
I think this is really important because it comes from Indiana County residents, and the way that this was all started was back in 2002, and this survey was developed, and every 5 years they have administered this survey, so this is the fourth one. What's really nice about this survey is we keep all the questions the same we have so far, so you're able to see the trends, and that's really important because if we start flipping all the questions, we're not going to be able to compare everything. So when we go into the communities, when we do some presentations in the community, we'll be able to kind of detail that down a little bit more because we have all the slides to show everyone. But I think that's really important to know that this has been going on since 2002. Yeah. And this year, we did have 1,106 people complete the survey. So we wished it could have been more, but, we'll take whatever we can get because it's really about Indiana County residents speaking up about what they want or what they feel is really an important issue.
Yeah, and so you identified a number of those issues, and
Yes.
you've been analyzing these for months now.
Yes.
To find out what are the trends and then try to develop strategies where you could meet them.
Yes,
meet the needs.
we actually we actually extended the survey until the end of January because we wanted a bigger response. And then also, as I told you last time, Dr. Eric Lauber over at the Marty Institute, he and his team of grad students, and they helped us analyze all the drug and alcohol information. And that just took a little longer, but it was so helpful for us. So one thing that I want everyone to know is that there are areas in the survey that we're not going to be able to do anything about as far as I can't really help too much with the water, hookups or the internet service, but we can get it to the people who can. We're going to pass the survey out, so planning's going to get some information and Indigo is going to get some information. The Drug and Alcohol Commission is going to get a lot of information because we had over half the respondents answer the open-ended drug and alcohol question, 595 responses.
Yeah.
It's a lot. So we're going to make sure everybody gets their pieces to look at.
We'll get into some of those categories shortly,
Yes.
but Kathy Abbey Baker, the Children's Advisory Commission, you have a special concern. Of course, you want to know how people and their kids, how their needs are being met, and what we can do as a county to approach those problems. What's your overall impression of what you were finding out from this survey?
My overall impression is that the survey tells us things we kind of already know, and it validates them by statistical analysis and all that kind of stuff. As far as the children's issues, we looked a lot at childcare and what kind of childcare people are using, what they need in the future, what they've used in the past, that kind of thing, how aware they are of the different services and the Pennsylvania state initiatives like Pre-K Counts and Keystone Stars. And then also just how overall where that might fall as far as needs for programming. And it has consistently been reduction in juvenile delinquency and reduction in drug and alcohol abuse, which isn't so much, that's not in younger children, but all our preventative strategies that we employ. For an example, and we've talked about this before, and all the needs assessments have shown that there's a need for free or low-cost recreational activities for families and children, and we continue to meet that need with our programs, our Fun Fest, Day of Play, our new bubble soccer tournament, and all the things that we do, low cost or free for families, which hopefully is preventative. And you can't measure prevention; it's really difficult. But we're hoping there's going into the future, as these kids that are in elementary school become high school students and beyond, that just that family bonding, those experiences have bolstered their resiliency and their reduced the risk factors involved with drug and alcohol abuse.
Yeah, it's interesting you put it that way. It's sort of like the glue.
Yes.
We're gonna glue this into them so that in future years it won't have drifted away from them. It will be a part of what they're all about. All right, so let's talk about some of the specific categories, Lisa, and some of the findings that really pop off the page at you.
Well, I think it's not surprising. The drug and alcohol issues are number one. That's the number one. One thing that I'd like to add to Kathy's is there was a new mandate. I can't recall if it's state or federal for the drug and alcohol commissions across the state. They must have prevention programs in elementary schools now. Now, our drug and alcohol program was already doing this, but that they saw that as a broader need across the country, and that's a mandatory education, prevention education that must be done now. So
Yeah. Well, you got to start them at the young age.
you really do. And I think it has to be a lot of, discussions, role modeling as parents. It has to be, you have to be able to talk to your kids about, the issues that are difficult. But I don't think anybody who had taken the survey or who works in this field is surprised that the drug and alcohol issues among youth and adults is the
That's
primary
that's-
concern.
That's the big thing. Were
Yes.
there things within those categories, within that specific category, that surprised you or really affirmed what you knew was happening?
Well, I think when we actually read the open-ended questions, that's where it was most surprising to me, because the questions ranged from, this is somebody's poor choice, don't help, all the way to give them as much help as needed. It ran the entire gamut. And so if we, well, like I said, we'll get more into those when we get down into the community surveys, because it's so much information. But other than that, I would think that the suicide prevention really came up strongly too on this survey. And I'm very sad to tell you that we already have 12 suicides this year. So that's just too many. We're just losing too many people. I think the lowest since I've been here, I think one year we were at 7 or 8, which is still a lot of people, but that's the lowest.
I think we were 12 for the entire year last year. I remember talking to
It-
Jerry Overman
yeah.
Jr. a couple
Yeah, 12
of
or
weeks
13,
ago.
yeah.
And we were only at 7 at that point.
Right.
So really this summer has been very, very difficult.
This has been a really, really tough, it was a tough July, I think, too. A lot of things going on, and we're not even a little over halfway through the year. So, but the good news about that is the Suicide Task Force of Indiana County has really pushed to get that QPR training into the schools, into the Indiana Regional Medical Center. They're now over at Indiana Regional Medical Center doing suicide screenings, and also at some of the doctor's offices. So that's a positive thing that's come out of this. We also see the fire hall stepping up. We've had fire departments, stepping up. So we've trained 2 fire departments already who requested the QPR training. It is the question, persuade, refer training.
Okay.
And so we have a third one already lined up. So I think everybody's starting to see the importance of this. So those were the 2 big ones that I looked at, and I'll let Kathy go on and let you know what the rest are, so we can get her in here too.
About the suicide stuff, this is the first year that has actually risen to a priority level in the survey. And if you think back to 2012 was a very tragic year, I think that was kind of the catalyst that got people realizing the problems that there are. We had youth suicides
In
multiple.
2012, there were youth suicides that seemed to be people seeing one person doing it and then copying it as their own behavior.
Right.
And that really can balloon. It can really.
So, looking at the years between the last survey, 2012 and the 2017, that is when the Suicide Task Force has been around for a long time.
Yes.
However, I think they became, had a push to become a little bit more active, a little bit more out there in the community. And okay, so there's a correlation between having that education and awareness, and that makes it an issue. Do you know what I mean?
Sure.
However, that is a good thing because that if it's on people's minds, then they're acting to educate themselves to do whatever they can for prevention.
Yeah.
So it's good to get it out there.
Yeah, once we know that people are aware of it as a situation, as a problem, and a circumstance here in Indiana County, we know that they're not just going to let it sit there in their lives. They're going to actually try to find solutions and try to become a part of that solution.
Right. And I think one thing that's really been positive out of all of this, we've been able to take the myth down that the more you talk about suicide, the more you're going to actually put it into somebody's mind. That's not factual. You're not, allowing somebody to think that. The person's already having thoughts. If they're already in that hopelessness and helplessness stage, they're already having these thoughts. So I think that was the biggest misconception when we were out in the community talking about all of this, is that people thought you're going to make somebody think to do that. But it's the thoughts are already there. Mm-hmm. Then how do you help? So now we're giving people the tools to be able to question, persuade, and refer them into mental health treatment that is that's needed. And I know the ER is, they take this very seriously when people show up over there. So that's where those screenings are coming into play. It's just really necessary. We can't afford to lose 12 people halfway through a year.
We're talking with Lisa Spencer and with Kathy Abbey Baker. The Indiana County Speaks Up survey of human services needs in Indiana County is up, and the numbers have been analyzed. And coming up, there will be a series of public meetings. We want to get into that in our next segment because we're going to extend this segment past the 8 o'clock news. Mm-hmm. You ladies have kindly agreed to continue there. But as we look at these numbers, and we've been talking about suicide, drug and alcohol, those are needs that people identify. But they're more along the lines of things that we see happening around us that we want to see become a real priority within Indiana County. There are other needs that aren't so dire as those.
You're right.
But in everyday life, those are needs that people see. You mentioned infrastructure. Of course, that's one thing. Kathy mentioned, of course, the recreational opportunities for young folks.
Yeah.
Are there others that stand out from the report as you've looked at some of these numbers?
Housing is an issue, and that's not within my wheelhouse at all. But the people have been citing that providing more affordable housing for the elderly. Mm-hmm. Housing in general.
I think it's across the board. But I guess what I would say to this too, because our rents are, they can be a little bit high, with around the university and things. So it's hard if you're not having a living wage to be able to sustain that. But over at the Housing Authority, I mean, they do have a waiting list, but when they send out all of the forms to everybody, they're only getting a handful back. Mm-hmm. So I think really, the help's there if we could get people to maybe respond back so we can get them into the affordable housing that they might be eligible for. So I think we have work to do on that as far as a county, I guess, just to try to look at, how else can we better meet that need? But
that's interesting because here we have people responding to a survey, asking, okay, these are services that are needed. There are resources and services are available in many of these cases. It could be that the people who are answering the survey care enough about the issue, but the people who are in need aren't aware of what those resources are. Maybe they're not the ones answering the survey.
Right.
And so there are two different populations we're talking about here, and we need to get the two of them together so that they can pick each other up and search for those sorts of solutions. Yeah. We're headed toward the top of the hour. It's just a couple of moments away. We will continue this conversation with Lisa Spencer and Kathy Abbey Baker, Indiana County's Department of Human Services, spearheading the Indiana County Speaks Up survey of human services needs within Indiana County.